Good morning to each and every one of you. This is Dominic Oliva with another one of your video vlogs on this beautiful Tuesday, January morning or afternoon of 2022. This is my very first video vlog on my hiking and travel page, and I just wanted to go over some things, and I debated about doing this video, but this is going to be a very sensitive topic. I'm going to be talking about this. Most of you know, and it's important to note that what I'm going to be saying here is in no way, shape, or form try to ruffle anybody's feathers. This is just giving information based on my understanding of it. So it's important to note that if you see this video and you feel some type of way, please do check your emotions. This is in no way, shape, or form trying to ruffle anybody's feathers. I'm just giving my basic standpoints, my basic understanding about this topic. So please don't feel any type of way. Don't act out of emotion. I'm giving this information based on what I understand. So again, as most of you already know, we are in Chapter 4, Day 4, Chapter 4 of 365, and Chapter 1 of 2022. Yes, I made that analogy. We're in page 4 in Chapter 1 of 2022. So I'm going to go ahead and bring up some stuff here. I'm bringing this off from the internet. These are not research articles. One of them is from Wikipedia, and I'm going to go ahead and read some stuff here. So if you will, please bear with me. Most of you already know by now that it's been almost 2 years since we've been through the coronavirus pandemic, and I'm going to read you a couple of things. And the intent for me reading some stuff is for me to have an understanding of it too. So I'm going to read a little bit more and just giving my general understanding about the coronavirus pandemic. So the coronavirus pandemic, according to Wikipedia, is an ongoing global pandemic of the coronavirus disease in 2019 caused by a severe acute respiratory syndrome, coronavirus 2, or SARS-CoV-2. The novel coronavirus was first identified from an outbreak in the Chinese city of Wuhan in December of 2019, and attempts to contain it there failed, allowing it to spread across the globe. The World Health Organization, or the WHO, declared a public health emergency international concern on January 30th of 2020, and the pandemic on March 11th of 2020. As of today, the pandemic has caused more than 292 million cases and 5.45 million deaths, making it one of the deadliest in history. The COVID-19 symptoms range from an undetectable to deadly. Severe illness is more likely in elderly patients than those with certain underlying medical conditions. COVID-19 is an airborne spread via air-contaminated microscopic virulence, I think that's how you pronounce it, viral particles. The risk of infection is highest among people in close proximity, but can occur over long distances, particularly indoors in poorly ventilated areas. Transmission rarely occurs via contaminated surfaces on fluids. Infected persons are typically contagious for 10 days, often bringing before or without symptoms. Mutations have produced many strains or variants with underlying degrees of infectivity or virulence. I think that's how you pronounce it. I can't pronounce some of these words. COVID-19 vaccines have been approved and widely distributed in various countries since December of 2020. Other recommended preventative measures include social distancing, masking, improving ventilation and air filtration, and quarantining those who have been exposed or are symptomatic. Treatments include monoclonal antibodies and are symptom control. Government interventions include travel restrictions, lockdowns, businesses restrictions and closures, workplace hazard controls, quarantines, testing symptoms, and tracing contacts of the infected. This pandemic triggered severe social and economic disruption around the world, including the largest global recession since the Great Depression. Widespread supply shortages, including food shortages, were caused by a supply chain disruption and panic buying. The resultant near global lockdown saw an unprecedented pollution decrease. Educational institutions and public areas were partially or fully closed in many jurisdictions, and many events were canceled or postponed. This was all in 2020. Misinformation circulated throughout social media and mass media, and political tensions intensified. The pandemic raised issues of racial and geographical discrimination, health equity, and the balance between public health imperatives and individual rights. Going to the etymology, the pandemic is known by several names. It is referred to as the coronavirus pandemic, despite the existence in other human coronaviruses that have been caused epidemics and outbreaks. During the initial outbreak in Wuhan, the virus and disease were commonly referred to as coronavirus. Wuhan coronavirus, the coronavirus outbreak, and the Wuhan coronavirus outbreak with the disease, sometimes called Wuhan anomia. In January of 2020, the WHO recommended the 2019 nCoV, acute respiratory disease, has interim names for the viruses and disease per 2015 international guidelines against using geographical locations, animal species or groups and people in diseases, and virus names in parts to prevent social stigma. The WHO finalized the official names COVID-19, this is the development of the names, and SARS-CoV-2 on February 11th of 2020. I'm just skim reading through here. WHO additionally uses the COVID-19 virus and the virus responsible for COVID-19 in public communications. My understanding is that this generally originated from it's important to note that there are certain different coronaviruses, but this one particularly came from bats, and this one came from Wuhan, China. Now, earlier, I did skim read through these, and my general understanding was that, in my experience, there were at least maybe two coronaviruses that we know of. We know of SARS. We know SARS-CoV-1 and 2. The SARS outbreak happened, the first one happened in 2003, but it wasn't as prevalent as it is today, SARS-CoV-2. My understanding and my guess is that the first SARS that happened in 2003 was well contained, and not many people died from this disease. Whereas coronavirus 2, this one right here, was not well contained, and hence it spread throughout many countries, as well as our country in the United States, and we're still struggling to contain this virus. Now my understanding is that we have the variants that came out, and now we have the my understanding is, I believe, is the Omicron variant now. We had the Delta before, but now we have the Omicron variant, and researchers, doctors, and people, they're trying to understand what this variant does. So we're just getting a basic understanding. Okay, so let's backtrack for a moment, alright? So we all know that the coronavirus, the development of coronavirus, SARS-CoV-2, happened in Wuhan, China around December of 2019, and it came to the United States around this time 2 years ago in 2020, and the state of emergency happened in March. This year, March 11th, will be 2 years since the outbreak of the coronavirus happened, and in my experience, we've been through a lot. You know, we've experienced lockdowns, we've experienced people panic buying the stores, schools were closed down, businesses were closed down, people were out of jobs. It's been really hard to manage this disease, as well as many events like concerts, plays, amusement parks, things that we wanted to do. Even restrictions, we were on lockdown for a couple of months, and we weren't able to really go anywhere. We weren't able to travel, limited transportation, everything was just so limited. So that's my experience. You know, I was limited to where I can go and who I could see. The only things that I did were go to work and come home here in this apartment. So I was only limited to a couple of things. While I did have some time with my close friends, again, the only things that I did were to go to work and then come home, and then every now and then I go for bike rides, but I wasn't able to really go out and travel anywhere. Everything was limited, like I said, and this coronavirus disease, this pandemic has affected each and every one of us to some degree. It's affected each and every one of our ways of living. It's changed everything. It's changed the lives of many Americans here in the United States. It's changed everything. You know, I did talk to a few of my friends, and I did have a chat with some of my acquaintances about this topic, and as far as people and developing of vaccines. And my understanding is that the doctors and scientists have went out of their way. They've gone out of their way. They've done extensive work to try to develop vaccines and any particular drug, just to, they basically did a lot of grunt research in understanding what the coronavirus does and the impact that it has on people, and they went ahead and developed vaccines. Now, I know there's going to be very mixed opinions about this. There's going to be mixed feelings on this. One can argue that the vaccines were developed very fast because this was done within the span of a year. It's important to note that half of us in the United States have already gotten their vaccination, so we have some sort of protection against. Again, I made a video a couple of months back. I'm not sure if it was on this page or if it was on my other YouTube page, but basically, in just my understanding of the vaccines, the intent or the objective for the vaccines is to prevent hospitalization or death. You can still contract the virus, but you won't necessarily die, especially if you're young and healthy. Coronavirus does affect young and healthy people too. So we have to take preventative measures in order to prevent hospitalization or death, because my understanding is that the healthcare, especially in the healthcare field, they're very strained right now, and they're very stressed because so many people were affected by the coronavirus pandemic and they're running out of hospital beds. So the healthcare workers are very stressed. And I can empathize. I'm not in that particular field, but I can't imagine what they've been going through for these past couple of months. So most of you know that there are 3 different types of vaccines. One is the J&J, the other one is the Moderna, and the other one is the Pfizer. Each are effective against fighting the coronavirus. They prevent hospitalization or death. I did get vaccinated a couple of months ago, back in May, and the one that I had was the Pfizer. I had the Pfizer shot, and in my experience, I had 2 of the shots, and I didn't feel too bad. I was feeling slightly lightheaded, but it wasn't as bad as it was before. I just had a pretty sore arm, and that morning when I woke up, the day after I got vaccinated, I made sure to have backup. I took pills, I took Advil. I made sure to take Advil and drink lots of water to and from my appointment. I made sure that I had some soup and ginger ale just in case. But I was okay throughout the entire day. I took an extra day off work, so I was pretty good. I didn't feel any side effects or anything like that. To this very day, here it is over 6 months later, and I still feel fine. There's no side effects. There's no allergic reaction. I don't have any bumps or anything like that. So in my experience, it seems like the Pfizer shot or any of the vaccines are effective. I'm not sick. I don't feel anything right now. That's not to say that I won't get coronavirus, because I could potentially still get coronavirus, but I won't be in the ventilator. So just giving my experience in taking the vaccine, I know some people are very hesitant to take the vaccine, and this is where I'm going to go, because I know this is a very sensitive subject that nobody really wants to talk about as far as vaccinations. And I had a talk with one of my cab drivers. I had a talk with this person about the vaccines, just the development of technology and the distribution of how they develop the vaccines. Basically, we have the technology here and now than the people that came before us had back then. When we had the Spanish flu, most of you know that the Spanish flu was also the pandemic, and it happened in the early 20th century. My understanding was that it was in 1918. So this was almost over 100 years ago. And back then, they didn't have all the advancements of technology. They didn't have the science and technology back then. They try to adapt, but, we're going through a similar battle. It's just now we have the technology, and people have been working extensively hard to try to gain an understanding of how the virus works and how it contracts to another person. And so they went ahead and made these vaccines. Now again, all that I'm saying is not factual, and I'm not acting out of emotion. This is only talking This is only talking from personal experience, so it's important, again, please do not act out of emotion. I'm just giving my basics, I'm just giving my personal experience on, as far as me getting the vaccination, and now we have the boosters. The boosters are out now for those that are eligible to go look into it and to gather information as much as we can before going in to get the booster. That's what I did before I got the vaccination. I made sure that I talked to my doctors and get some information. I didn't just jump into it. So I think that's where people get misconstrued, is that they automatically just jump in and just get the vaccination and that's it. They didn't do any due diligent research. Some of us did, and some of us listened to the doctors, because doctors and scientists, they specialize in that field. So, and they've been, like I said, they've been doing extensive work on this and learning and understanding as much as they can about the coronavirus. But going off to what I said, we have the technology now than most of the people growing up in the 1900s had back then. So I know this is where things are going to get very iffy. Like I said, there's going to be very mixed feelings on this. Some can argue, and I'm just going off of what basically what I hear other people have said, is that basically there's been a lot of conspiracy theories, Vaccines cause infertility, the vaccines mark the mark of the beast, prophetic stuff, stuff that you get from the Bible. There's a lot of bias in the media, and I know that much. I know there's a lot of bias going on in the media, especially social media and what we see on Facebook, and nobody wants to talk about this, but they're using false information. I'm reading something called the VAERS. VAERS basically stands for Vaccine Adverse Event Reporting System. This was established a year before I was born. This happened in 1990 in the United States. And the overall intent for this program, or the VAERS, is to report any adverse effects that a person may have received from the vaccine. So basically, anything that happens to a person after receiving any type of vaccination, whether it be a flu vaccine or any of the vaccines, polio vaccines, or any medicine, they report that any adverse reactions or any allergic reactions that they may have. They might have skin rashes or development of bumps or any bruising or anything like that, swelling of the lips or eyes or anything. They report that to the VAERS. And that's what it's used for. But the overall intent of, getting the vaccines, and, one can argue again that the vaccines were developed too fast, but in my experience of what I've seen, when you go in to get your vaccine, they have you wait for at least 15 to 30 minutes. That's what they do. After you get the vaccine, they have you wait to see if you develop any reactions. And I think that's where some people get misconstrued, because there's a lot of bias in the media, and some of the people, they're using VAERS to report any false information. So again, I can understand why there may be some people that might be hesitant or skeptical about getting one of the 3 vaccines for the coronavirus. Is because, again, there's a lot of misinformation, and people don't trust. It's important that, what it all boils down to is trust issues. People have a hard time trusting the media because they're spewing all this different information. We see this everywhere, on the news, on YouTube, and even on Facebook. They're reporting instances where people are supposedly dying from the coronavirus vaccines. They're spewing all that information, and they're using some of that information and they're putting it into the VAERS. VAERS is like a type of, I equate this to a type of Wikipedia, because my understanding is that people can report anything. What you're seeing is not necessarily, I guess what I'm trying to say is, things are not as what they seem to be. I don't know if I agree that most of the people die from the coronavirus vaccination. There may be a select few that may die from it, but that's because of underlying health conditions. And age also factors into it. I consider myself a healthy young man, 32 years old, and I weigh at least about 150 pounds. That's healthy. Any weight from 144 to 176 pounds is considered healthy weight. So I appear to be in shape. You know, I am pretty active. I ride a bike I ride a bike a lot. So I am relatively active for my age. So, you know, considering and putting all these things into play, you know, age, health, and underlying health conditions do play a factor into that. So again, if you were to ask for my personal opinion or my intake about the whole situation with the coronavirus and the vaccines and the overall bigger picture, my opinion is, okay, let me just put it like this. So we have doctors and nurse practitioners and scientists that specialize in their field of study, and then you have all these outsiders, you know, people that serve in politics. I think when all is said and done, I think the bigger issue lies when people don't want to do what they're told, or people don't want to take the vaccines mainly because they're being told by somebody else. I think it boils down to politicians and putting their 2 cents into it, because again, I think that the scientists and the doctors, they specialize in their field of medicine and vaccines and, you know, understanding viruses. They specialize in their field, and I think the reason why people have a hard time going by what they're being told is because they have a hard time trusting the people in the government, which again, I can understand why some people are hesitant taking vaccines and, you know, getting the type of help that they need is because they don't trust the government. I can understand that because, you know, one can argue that this is all in the form of control. And I'm neither agreeing nor disagreeing. I'm just trying to understand for myself. But based on what I know, again, these people or scientists or doctors, they specialize in their field of study. But then you have all these outsiders like these politicians or the people that serve outside of office. They want to put their 2 cents into it. And so I think that's where the issue lies. The issue boils down to trust and skepticism because they're being told by a politician to do something. So if we look back in our history, you know, as far as government control and all these conspiracies and things that have happened in the past, I think that's what's going on. I think that's what's happening. I'll go ahead and I'll say it like this, and I'm going to leave the video off because it's getting late in the afternoon and I'm about to step out for a moment. I'm gonna say it like this, and I know there's going to be mixed feelings on this, but there's a reason why they say doctor's orders. I'm not a doctor, nor am I a nurse, but the people that work in the hospitals or in the doctor's office, again, they specialize in their field. So it's important to get the information that you need before you make an informed decision, but don't listen to all of these politicians or people that are serving in office. I think that's where the bigger issue is. People are feeding into the false information, or the people like Carl Tuckersons of the world. And I know that's it's a sensitive subject, but I just want to put that out there. I'm just trying to distinguish for myself what's true and what's not true. You know, there's a backlash in between, you know, what one person says and the other person says. So we just have to find that middle. And I think the problem lies when people or politicians or people that work in the office or, you know, are in the news media, they put their 2 cents in what they think, what they know about the vaccines, and they spew that information. So I think that's where it all boils down to. So I hope this video does make sense. I know I tend to stumble on my words and my speech, but I was just trying to get to the bottom of it. Once again, if you did enjoy this video, please stay updated for more future updates. And this video is on my hiking and travel page. I'll make sure to have more stuff in the upcoming months, but right now, as you can see, it's pretty cold outside. I have a sweater on because it's very cold outside, so I can't really go anywhere. Temperatures are in the upper 20s today. Yes, I live in New York, so we get all of our cold winters up here. So currently, right now, there isn't anything going on, and I'm not going to have any material right now. You're not going to see any of my biking videos or hiking place, or you're not going to be able to see any traveling or anything like that until later in the year. Hopefully I'll have some stuff down later in the months to come. But again, if you did enjoy this video, like I said, please don't act out of emotion. Take it how you may, but this is just giving my information based on what I know. This is just giving my viewpoint of the situation. In regards to the booster shots, I'll be looking into getting my booster at some point. But if you do decide to go out, please make sure, and I'll make sure for myself to get the informed information as much as I can before I go in to get the booster shots. Make sure that I know and understand the overall intent, and I'll say this too to my very few viewers. Before you make an informed decision, make sure you get as much information as much as you can. Look from another source. Read as much as you can. Ask questions and make an informed decision. And do what you feel is right for you. All right, that's where I'll leave the video off. Do whatever you have to do to try to slow this virus. Let's try to beat this pandemic as much as we possibly can. Like I said, get the information that we need. And yeah, hoping for good things to come in 2022.